Dr. Rose, what is compression neuropathy?
A compressive neuropathy is essentially a pinched nerve. That may be something like carpal tunnel syndrome or cubital tunnel syndrome, which is very much like carpal tunnel syndrome. It just involves a different nerve at a different region near the elbow. Also, things like herniated discs also fall into that same realm of a compression neuropathy. Essentially, these things can be typically treated very conservatively, usually with splinting and activity modification. But however, sometimes these don't get better with just those simple means. Sometimes they do need to have some sort of surgical decompression. And it's important to address these things early, because if they're not addressed early, they can lead to problems such as sensation loss and motor function loss, which sometimes need a bigger reconstructive procedure in order to be able to address that problem. Now, symptoms usually present in these early with sensations like burning, tingling, and sometimes even that sensory loss in a particular nerve distribution. It's important for us to be able to see folks early on after they've started to develop these symptoms so that we can help lead them through the treatment course. And usually that starts with some form of activity modification and even splinting. As we work these things up after we've done a full history and physical, is typically to get a study called an electrodiagnostic evaluation, and that helps us be able to assess what nerve is giving the problem and where in that nerve the problem is, so that we can best focus our treatment on that. Now, as time goes on and patient symptoms either get better, or if they don't get better or potentially get worse, then sometimes surgery is needed. Good thing for patients to know is that if these are addressed early, they can typically be addressed with a simple decompression, just a release of the nerve, and that often gives some pretty immediate relief of symptoms. Patients usually are able to get back to work after about a week or two if it's light activity, and usually back to full activity by 6 to 8 weeks after surgery.
Okay. Thank you.